Hello, good evening, friends. This is Dr. Chetna Jain. I'm obstetrician and gynecologist, a senior consultant and director at the newly opened Cloud9 Sector 14 Hospital. Today, we're going to talk on bleeding in late pregnancy. So, bleeding in pregnancy is a very common problem. But bleeding in late pregnancy is not that common. It's alarming most of the times, though very slight spotting. So let's talk on what is bleeding and what is not. So between 37 and 40 weeks of pregnancy, when woman actually goes into labor, there would be some kind of spotting, which could be a maroonish discharge, pinkish discharge, a brownish discharge, a black discharge, or actually some kind of mild bleeding. So this happens because of the opening of the uterine mouth, which leads to breakage of certain small blood vessels. This is known as show, SHOW, show. And this has nothing to worry. This is very common and this will last for a couple of days before the woman goes into actual labor, or the same day the woman can go into labor. So, show is not a problem. However, if you see any such spotting bleeding in the ninth month of pregnancy, you should see the doctor immediately. So what will happen once you see the bleeding? So suppose you're sleeping in middle of the night, you find yourself wet. You get up and you find that there's some blood stain on your underwear. What are you supposed to do? So first thing you're supposed to do is visit your doctor's hospital and inform that what you have got. Don't wait till morning. Please remember, don't wait till morning. Report to the hospital immediately. Probably there is nothing very serious. It's not a serious condition. It's probably a false alarm, but it needs to be seen. So once you're in the hospital, the duty doctor is going to check your pulse, blood pressure. They will check whether the baby is in good condition, whether the abdomen is very stiff, you are contracting, relaxing, or is permanently stiff, or there is no pain at all. They will go into your records. They will check the heartbeat. If required, they can run an NST or CTG, which is an ECG of the baby, which can determine whether the baby is healthy or baby is in some kind of trouble, whether baby is getting enough oxygen or baby is not getting oxygen. All that can be seen. Even your uterine contractions, intrauterine pressure can be monitored by the same machine. After this, the doctor will also evaluate your records, and if required, they will do an internal checkup. So there could be a peep-in examination to the mouth of the uterus, which is popularly known as cervix, and to see whether there's any polyp which is bleeding or something else, and also to determine the amount of bleeding. If the ultrasound suggests that the placenta is in place, we can do an internal checkup to see that you are in labor or not. So these are the basic things that will be performed. Now that if you have never done any ultrasound, so the first thing once you report bleeding is to do an ultrasound to locate the placenta, to see that the placenta is highly located and it is not anywhere in close proximity to the uterine opening, that the placenta is not separated from the uterine wall and there is no collection of the blood behind the placenta, or there is nothing which is indicative that the placenta has left its place and it is bleeding. So, bleeding in late pregnancy could be because of either abruption, that is the placental separation, or a low-lying placenta, which is known as placenta previa, or third, a patient could be in labor. There are certain other rare conditions like vasa previa, which is very rare, and this is typically we tell the patient if they have vasa previa. So here the placental blood vessels, they cross the uterine mouth, and what happens is as soon as the patient goes into labor, they break and they bleed heavily, and this bleeding is essentially very harmful to the fetus. So it is very important that if you have bleeding, you report immediately to the hospital to know the kind of bleeding which is there. In majority of the cases, it turns out to be show, 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 which is a part of early labor, and the patient is sent home with reassurance after proper fetal assessment and maternal assessment that everything is okay. The patient is reassured that everything is fine and patient is also told what were the other symptoms for which if she notices, then she can come back. So typically the labor will be associated with intermittent uterine contractions. There might be some leaking that the water bag has is bursting, but all the while the fetal movements have to be good. There has to be at least one movement every hour. If any time the pregnant woman after 28 weeks starts feeling that the fetal movements are less than one every hour, and for 2 3 hours there has been no movement, whether it is day or night, you must report to the hospital. Please listen to it very carefully. Whether it is day, whether it is night, you must report to the hospital if you think there are no fetal movements. So, less fetal movements and vaginal bleeding at the time of late pregnancy is very, very risky. Now, the causes of these bleeding, as I told you, placental separation. Now, placental separation in majority can happen on its own without anything, but sometimes there's a history of falling down, or sometimes there's a history of somebody hitting the abdomen, like the elder child by mistake while playing, hit by head or by leg, or somebody playing balls, it comes and hit you, or you are walking and somebody, so there's some road accident kind of situation. Or there could be some other causes which can lead to blunt trauma abdomen and leading to placental separation. But in majority, such history is not noticed. That means it happens on its own. Now, whenever there's placental separation, the bleeding is of two kinds. One is a concealed, other is revealed, and third is both combined. Now, concealed bleeding is one which is most dreadful and most dangerous because the blood starts accumulating behind the placenta. It doesn't come out, the woman doesn't notice, and in the abdomen, there's a large collection of blood, 1.52 liters, before the patient can realize that the abdomen is unusually very stiff, the baby is not moving, or a few drops have come out. And so on ultrasound only, we can recognize the severity, and sometimes it is that severe that if we don't take out the baby, if the baby is still alive and we don't take out the baby within minutes, we may actually lose the baby. So it is extremely important to diagnose if there is bleeding, and if there is bleeding, whether there is no concealed bleeding. Revealed bleeding is something when the patient will report immediately, and it is much smaller in quantity. So if any woman will see half a pad or even a coin size of blood spot, she will come rushing to the hospital and we can evaluate. And majority of the times, if the bleeding is mild, it can be stopped with proper rest and adequate progesterones and other kinds of treatment, and the pregnancy can be allowed to proceed till a good maturity of 37 weeks. But if the bleeding is very severe, wherein the maternal life is at danger or the fetal life is at danger, then we have to determine whether the pregnancy can be allowed to continue further, or whether with rest the things will get arrested and the clot will get healed and the baby can further mature inside, because this is what we as obstetrician, this is our job, to keep the baby inside the womb as much as possible so that the baby gets the oxygen and the food directly from the mother, and the baby doesn't need to go to incubator or to the nursery. But if the placenta is separated moderate enough, where the bleeding is too much, where the maternal life is at danger, then at the time it becomes that urgent that the baby is taken out and put it in the nursery. And these babies do fairly well when taken out in time. They recover very fast. These women, if they, depending on the amount of blood they lost, they will need blood transfusion sometimes, or sometimes they might not lose. We end up removing sometimes 2 liters of blood from the uterine cavity, which is very huge. It drains the mother like anything. The hemoglobin can actually drop from 12 to 6 grams. So please, if you see any kind of bleeding, if you think your abdomen is getting unusually tense, if you think there are no fetal movements, if you think the water bag is broken, please, please, please report to the hospital immediately. So the other cause of bleeding is placenta previa. Now here what happens is the placenta is lying very low. It is very close to the uterine mouth, the os, internal os we call it. It is either covering or it is within 5 centimeters of the os. Now, as soon as the woman goes into labor, the os dilates and the lower end of the placenta separates and starts bleeding. So, first thing, if you know that you have placenta previa, you must immediately rush to the hospital. And the first thing, you must inform the health personnel there, which is a attending nurse and an attending doctor, that you have a placenta previa. We will inform you what is your grade 1, grade 2, grade 3. So you will know if you have placenta previa and which grade. So, and if you can't remember, you can just show your records. The doctor can read. And if you have placenta previa, please remember, internal examination by finger is a big no. But in such cases also, a metallic equipment which is known as a speculum examination still can be done. An internal ultrasound, if required, can be done. So placenta previa, to know the exact location sometime, the external probe is not sufficient enough, and an internal ultrasound is required to know the lower edge of placenta is located where exactly, how many millimeter or centimeter from the os. A good idea, a good thing is to have the placenta at least 5 centimeter from the internal os. It will never bother you. It is a very small chance that this placenta can create any problem. But a low-lying placenta or a placenta previa can actually bleed in pregnancy, and these women will eventually need a cesarean delivery. They cannot have a normal delivery if the placenta remains low-lying or previa by the time they need to deliver, that is 37 weeks and beyond. So the placenta can migrate up only till 35 weeks. After 35 weeks, there is no change of placental location and the placenta remains wherever it is. So at 35 weeks scan, if the placenta is upper, it is upper, and if it is a previa, it remains a previa forever for this pregnancy. And please do not believe that placenta previa patients can have normal delivery, accept it as a fate. And if it is a previa, please accept the cesarean delivery with humbled hand, because placenta previa delivery is also a very difficult delivery for the doctor, because sometimes the bleeding is humongous. The placenta, when it is located in the lower segment of the uterus, tends to bleed a lot because the lower segment doesn't contract as well as the upper segment, and hence the bleeding is too much whenever the placenta is previa. In abruption, this is not the case. In abruption, if the placenta is located up, even if it separates as soon as you deliver, the placenta comes out, the uterus will immediately control the bleeding, and once the baby and the placenta are out, the bleeding is controlled and the mother is safe. However, in placenta previa, even after the baby is out, the placenta is out, the placental bed can continue to bleed, and sometimes it becomes difficult to control the bleeding. And hence, if it is a central placenta previa and the hemoglobin is borderline, we would actually arrange for blood. We will ensure that your hemoglobin is 12. If not, then we arrange for blood and keep it ready just in case you bleed so much, then it can be given. Otherwise, God willing, everything goes well and you would not need anything. So majority of the previa would not need transfusion. Arranging for blood doesn't mean that all previas would be transfused. No doctor would want to transfuse a patient unless it is absolutely essential. So a transfusion is always taken as life-saving. It is not fun. It is risky. Certainly we don't want to do it, but if required for maternal health, it has to be done, then it has to be done. Then there is no choice given. So it is important to maintain your hemoglobin above 12, your platelet counts above 150, so that you control your bleeding well. It is stemmed very properly, and if once the placenta is out, your bleeding is stemmed, you are very safe, there is no problem. In case of abruption, a normal delivery is possible. Majority of the times, when the patient is in abruption, the patients are already 7-8 centimeter dilated, and in no time they deliver. By the time the patients are taken to labor room, they are fully dilated and they deliver very fast. This is God's kind way of preventing further blood loss and difficulties in oxygen supply to the baby. But sometimes the cervix is very rigid, and in this scenario, we might need to do a cesarean. So whatever it is, bleeding in late pregnancy has to be taken very seriously. And so many times we see that the bleeding starts and the women, they tend to ignore, they believe that it will settle, it's a part of labor. Yes, majority of the times it's a part of labor, but please try and understand that if the bleeding is mucoid, very tiny in quantity, maroonish in color, brownish, spotting, the uterus is relaxing intermittently, the fetal movements are good, the water bag is intact, then probably there's not much to worry. Still, you get it verified once with the doctor, and then you will understand that okay, it's all right and nothing to worry. But in rest of the situations, please rush to the hospital. And whenever you're rushing, ensure that you carry all your documents so that the doctor knows exactly. And in that emergency situation, the placental location, when previously known, is the most grace saver. You know, it is, if we know the placental location from the beginning, it is very easy to manage the patient. But if it is not known, we can still do the ultrasound, but then that there is a significant delay in doing all this. So please, a request that if you have the smallest of amount of bleeding, please carry all your documents and rush to the hospital. If you think your hospital is far, you may go to the closest maternity center, whatever you have close to your place, and see a doctor, and then decide whether there's an emergency or it's a routine thing. And if it is a routine thing, you may report to your treating doctor and your treating hospital. And if it is an emergency, you may take the initial resuscitation or whatever primary management is required till you are stabilized in that particular center before you move on. Luckily, we live in NCR, wherein we all have good access to good hospitals all the time, and in majority of the cases, you are able to reach a good hospital in 1 hour. So please ensure that you reach on time. The other cause of bleeding in late pregnancy could be a disturbed coagulation profile, wherein the bleeding tendency is abnormal. And why it can happen? It could happen because of deficiency of placenta or deficiency of various coagulation factors. So the various coagulation factor deficiency are generally seen in genetic conditions. They are very rare that they happen because of the abruption, but in majority it happens because of the genetic deficiency of various coagulation factors. And such a case, if it is pre-recognized, they are dealt with accordingly, so that at the time of childbirth, your coagulation profile is normal. We do a detailed coagulation screening before you deliver, so that we are absolutely sure that when you deliver, you don't bleed excess, because every drop of blood is very precious. So we ensure that you don't bleed extra, you save your blood, because when you have blood in your body, you have sufficient energy to look after you and your child. Once you lose a lot of blood, you are lethargic, your oxygen carrying capacity is less, you are breathless, you may suffer hair fall and other problems. So it is important to ensure that you eat healthy, ensure that your hemoglobin is at least above 11 throughout the pregnancy, and if you have a placenta previa, kindly ensure that your hemoglobin is around 12. If you are a negative group, then all the more important to maintain your hemoglobin well, because it is very difficult to get negative blood in India, because our population is only 2 to 3% negative and rest all are positive, unlike the Western world where 15% population is negative and they can find the negative blood very easily. I am not suggesting that everybody needs blood. What I am suggesting is, please maintain your hemoglobin, ensure that you're in good health. So God forbid, even if you have only 1% chance of landing into an abruption or a placenta previa, we can handle it once you are strong enough to handle, and you will not face any kind of problem. No weakness, no lethargy, no blood transfusions, and you will go home in time, like within 48 hours or less than that after the delivery is over. So I am open to the questions. So, but once again, I would like to emphasize that bleeding in late pregnancy could be very serious. Please report to your doctor as soon as possible. मैम, मेरी प्रेगनेंसी का 6 मंथ्स कंप्लीट होने वाला है, 2 दिन से ब्लीडिंग हो रही है, मैं क्या करूं? फर्स्ट थिंग, आपको सबसे पहले जो ये करना है, वो आपको एक अल्ट्रासाउंड करके देखना है कि कहीं आपका प्लासेंटा अपनी जगह से हिल तो नहीं गया, दैट इज एब्रप्शन तो नहीं हो गया। दूसरा, आपके डॉक्टर को इंटरनल चेकअप करके देखना होगा कि आपका जो यूट्रस का माउथ है वो कहीं ओपन तो नहीं हो रहा है, कई बार यूट्रस के माउथ पे छोटे छोटे पॉलिप्स या कोई ग्रोथ होती है, वो भी ब्लीड करती है। प्रेगनेंसी में इंटरकोर्स करने से भी कई बार ब्लीडिंग हो जाती है। तो जिन पेशेंट को अगर सर्विक्स में छोटा सा भी घाव होता है, तो वो प्रेगनेंसी में इंटरकोर्स करने से, या अगर नीचे से अंदर से टैबलेट रखने थे, जैसे कि जो वेजाइनल टैबलेट जो प्रोजेस्टेरॉन सपोजिटरीज दी जाती है, उनको रखने से ब्लीडिंग कभी कभी हो जाती है। सो ये कारण पता लगाना बहुत ज़रूरी है कि ये ब्लीडिंग कितनी है, कहाँ से हो रही है। मेजॉरिटी ऑफ द केसेस, जैसे मैंने आपको बताया, 1-2% को छोड़ के सब ठीक होते हैं, लेकिन ये 1-2% जो होते हैं वो बहुत सीरियस होते हैं। सो प्लीज़ आप एक अल्ट्रासाउंड कराइए और एक इंटरनल चेकअप कराइए, तो आपको अपना ब्लीडिंग का कारण पता चल जाएगा। मैडम, मेरी प्रेगनेंसी हर बार 6 वीक्स में ब्लीडिंग होती है। ऐसा मेरे साथ 2 बार हो गया है, क्या प्रॉब्लम हो सकती है? आपका केस रेकरेंट फर्स्ट ट्राइमेस्टर मिसकैरेज का है। रेकरेंट फर्स्ट ट्राइमेस्टर मिसकैरेज, इसमें क्या होता है, बार बार प्रेगनेंसी लॉस होती है। इसके कई कारण हो सकते हैं। कई बार माँ बाप का जो ब्लड होता है, उसके अंदर जो क्रोमोसोम्स होते हैं, जो जीन्स होते हैं, उनमें कोई खराबी होती है, उसकी वजह से नहीं हो पाते। कई बार क्या होता है कि जब ये एग्स और स्पर्म्स बनते हैं, तो उनके क्रोमोसोम्स खराब हो जाते हैं, तो जब ये मिलते हैं तो ये एम्ब्रियो के जो क्रोमोसोम्स हैं वो नॉर्मल नहीं होते, उससे ऐसा हो जाता है। इसके अलावा कुछ और टेस्ट होते हैं जो कि बॉडी के अंदर थ्रोम्बोटिक टेंडेंसीज के लिए होते हैं। तो ये थ्रोम्बोटिक जो टेंडेंसीज होती हैं, उसमें छोटे छोटे बॉडी के अंदर, प्रेगनेंसी के अंदर माइक्रो क्लॉट्स बन जाते हैं, जो इसको ब्लॉक कर देते हैं प्लासेंटल सर्कुलेशन और बच्चे के ब्लड सप्लाई को। और इसके ब्लॉकेज की वजह से बच्चे को ऑक्सीजन बंद हो जाता है और बच्चे की डेथ हो जाती है बहुत जल्दी। तो इसके लिए काफ़ी टेस्ट अवेलेबल हैं जो किए जा सकते हैं, और अगर इनमें से कुछ निकल आता है तो इनका ट्रीटमेंट ब्लड थिनर टैबलेट्स और ब्लड थिनर इंजेक्शंस के भरोसे किया जाता है। अगर प्रोजेस्टेरॉन डेफिशिएंसी होती है तो उसके लिए वेजाइना की टैबलेट्स या मुंह से दी हुई टैबलेट्स या इंजेक्शन लगाए जा सकते हैं, उससे ये प्रेगनेंसी लॉस को रोका जा सकता है। रेकरेंट प्रेगनेंसी लॉस एक बहुत कॉमन कंडीशन बन चुका है। इसके फैक्टर्स एनवायरमेंटल भी हो सकते हैं, जेनेटिक भी हो सकते हैं, हेरिडिटरी भी हो सकते हैं, एक्वायर्ड भी हो सकते हैं। सो इन सब के लिए अलग अलग तरह के टेस्ट होते हैं। आप डॉक्टर से मिलिए दूसरी प्रेगनेंसी करने से पहले। जब ये प्रेगनेंसी का हो जाएगा फिनिश, उसके 45 डेज के बाद, 45 दिन के बाद ये टेस्ट किए जाएंगे। उसमें आप में क्या खराबी हो रही है, क्या प्रॉब्लम आ रही है, वो पता चल सकता है। मेरा 6 वीक्स चल रहा है, मुझे थोड़ी ब्लीडिंग हुई है और रुक गई है। मैंने अल्ट्रासाउंड कराई थी, उसमें बेबी की हार्ट बीट नहीं सुनी थी। क्या मेरा बेबी सेफ है या नहीं, प्लीज़ बताएं। ऐसा है कि अगर आप अल्ट्रासाउंड के अंदर आपके बेबी का साइज, जिसको CRL बोलते हैं, क्राउन रम्प लेंथ, अगर 6 मिलीमीटर ऑलरेडी रिकॉर्ड हो गया है और अगर 6 मिलीमीटर पे हार्ट बीट नहीं दिखाई दे रही है, तो ये प्रेगनेंसी नहीं चलती। लेकिन अगर जो CRL है वो 6 मिलीमीटर से कम है या अभी फीटल नोड अपीयर ही नहीं हुआ है, तो ज़रूरी नहीं है कि 6 वीक्स पे हार्ट बीट दिखाई दे। तो 6 वीक पे अल्ट्रासाउंड अगर किसी बहुत ही अच्छी मशीन से किसी सीनियर ने किया है तो दिखाई दे सकती है, नहीं भी दे सकती। लेकिन 7 वीक्स अगर कंप्लीट हो जाते हैं अगर श्योरिटी से आपका बच्चे को, तो हार्ट बीट हर हाल में सुनाई आनी चाहिए। पर ये जो 7 वीक्स पे जो अल्ट्रासाउंड होगा वो फ्रंट पैसेज से होगा। 8 वीक्स पे अल्ट्रासाउंड ऊपर से किया जा सकता है। अगर आपके पीरियड्स डिले होके आते हैं, अगर आपका साइकिल 28 डेज का नहीं है, उससे ज़्यादा दिन बढ़ का है, तो आपको उतने दिन 6 वीक्स में से घटा के फिर देखना होगा। और जब 6 वीक्स 4 डेज या 7 वीक्स के आसपास की प्रेगनेंसी हो जाएगी, तब अल्ट्रासाउंड करना होगा। लेकिन अगर अल्ट्रासाउंड के अंदर CRL 6 mm आ गया है, तो इसमें कोई गड़बड़ होने की संभावना है। हेलो मैडम, मेरी 2 महीने की प्रेगनेंसी है, हल्का स्पॉटिंग है, तो नॉर्मल है क्या, या कोई प्रॉब्लम है? बिना अल्ट्रासाउंड के कुछ भी नहीं कहा जा सकता कि ये प्रेगनेंसी अच्छी है या नहीं, क्योंकि हार्ट बीट आने के बाद भी जा सकती है। तो किसी भी वक्त अगर प्रेगनेंसी में स्पॉटिंग होती है, स्पेशली खास तौर से 10 वीक से पहले, 10 हफ्ते से पहले, तो अल्ट्रासाउंड करके ज़रूर देखना चाहिए दोबारा, या पहली बार अगर नहीं देखा गया है पहले, तो कि उसमें हार्ट बीट है या नहीं। हार्ट बीट है तो वो ठीक है कि नहीं, 120 के ऊपर होनी चाहिए पर मिनट, और अंदर में कोई क्लॉट तो नहीं जमा हो रहा है, अंदर में कोई और प्रॉब्लम तो नहीं है। जो बच्चा जहाँ से निकल के आता है एग से, वहाँ पे जो कॉर्पस ल्यूटियम बनता है उसकी ब्लड सप्लाई ठीक है कि नहीं, आपका जो जहाँ पे बेबी ग्रो कर रहा है उसके चारों तरफ का डेसिडुअल रिएक्शन कैसा है, ये सारा देखा जाता है। तब उसके बाद पता चलता है कि प्रेगनेंसी के क्या हालात हैं। तो आप अपने डॉक्टर जिनसे अल्ट्रासाउंड कराते हैं उनसे ये सारे सवाल कर सकते हैं। मैडम, प्रेगनेंसी में ब्लड आने का क्या क्या रीज़न होता है और क्या ऐसे इसे रोका जा सकता है? प्रेगनेंसी में ब्लड आने के बहुत सारे कारण हैं। अब ये अर्ली प्रेगनेंसी में है या लेट में। जैसे मैंने बताया, लेट प्रेगनेंसी के अंदर प्लासेंटल सेपरेशन, लो लाइंग प्लासेंटा, वाजा प्रीविया और कोएगुलेशन डिफेक्ट्स होता है। अर्ली प्रेगनेंसी में भी इसी तरह के सिमिलर कॉजेज होते हैं, बट उनको इस तरह के नाम नहीं दिए जा सकते। अगर अर्ली प्रेगनेंसी में ब्लीडिंग होती है तो जनरली कंट्रोल में आ जाती है, कोई घबराने की ज़रूरत नहीं है। इसके लिए काफ़ी तरह के प्रोजेस्टेरॉन दिए जाते हैं, बस बच्चे की धड़कन चलनी चाहिए और बच्चा स्वस्थ होना चाहिए। बच्चे के स्वस्थ ना स्वस्थ होने की पहली निशानी 12 हफ्ते का जो फर्स्ट अल्ट्रासाउंड होता है, जिसे न्यूकल स्कैन और अर्ली एनॉमली स्कैन कहा जाता है, उसमें पता चलता है। उससे पहले कोई भी डॉक्टर किसी भी कंडीशन में ये नहीं बता सकता कि ये प्रेगनेंसी हेल्दी है या नहीं। मेरी वाइफ का 7th मंथ पूरा होने वाला है। उसको फर्स्ट ट्राइमेस्टर में प्लासेंटा प्रीविया था, लेकिन 6 मंथ्स में ठीक हो गया। अब 7th मंथ में सुबह-सुबह जब वॉशरूम जाने के टाइम ब्लीडिंग हो जाती है। आपको दोबारा से एक बार अल्ट्रासाउंड करके कंफर्म करना चाहिए कि प्लासेंटा, जैसे आपने बोला, अगर खिसक गया है, आपको श्योरिटी है खिसक गया है, तो भी प्लासेंटा को देखना पड़ेगा कि वो अपनी जगह से खिसक तो नहीं रहा। और अगर प्लासेंटा अपनी जगह पर स्टक है, उसके पीछे में कोई क्लॉट नहीं है, तो एक इंटरनल जांच करके फ्रंट पैसेज को स्पेकुलम के थ्रू देखना होगा कि वहाँ पे कोई अल्सर तो नहीं है, कोई पॉलिप तो नहीं है, कोई और ग्रोथ तो नहीं है, जिसकी वजह से हो सकता है लोकल कॉज हो ब्लीडिंग का, सर्विक्स से आ रही हो और यूट्रस से नहीं आ रही हो, ऐसा हो सकता है। तो ये बहुत इम्पॉर्टेंट है कि आप उनका एक चेकअप करवाएं प्रॉपर। Thank you very much for your questions. Next month, join me same time, same day here. We'll bring up some nice new another topic. But if you want to hear on something, please write to us. We will try to accommodate you. Thank you.